Hi, welcome back to the Dr. Second Chance channel. Please like, subscribe, hit the notification bell icon, and share the video with your friends. Today, we're talking about the results of a study that was published in 2017 in the Journal of Drug and Alcohol Dependence called a long name, uh, Prevalence and Pathways of Recovery from Drug and Alcohol Problems in the United States Population, Implications for Practice, Research, and Policy. And this is a really important study because we've learned a lot of new things from this study. It was done surveying 40,000 people, of which 25,000 responded, of which 2,000 were used to do the analysis. They were asked a question: did you used to have a problem with drugs or alcohol, but no longer do? The strict clinical criteria for diagnosis was not used. It's just people saying, yeah, I had a problem once and I don't anymore. And then the authors diving in to find out what exactly happened. How is that possible? So what was found is that about, and then the results of the study used to extrapolate big, what's likely in the larger population. Well, based on this study, it's likely that about 20 million people at some point or another have had a serious drug or alcohol problem and no longer do. And of those, around a half would say that they are in recovery. And using that terminology is usually what people use when they've been in formal kind of drug treatment programs and going to AA and other groups like that, like Smart Recovery. And so, what's really amazing is there's this large number of people that have gotten better, of which half of them didn't use any of the kind of classic techniques and treatments for getting well. And so, it begged the question the authors were looking at: well, how did people get well? What kinds of treatments were used, and then some thoughts about the people that seem to get well without using the classic medical type of stuff. And so when you look at the around 10 million, half of the 20 million, a little more than that, they were found to have used what's called an assisted resolution pathway. That means they did things like go to professional inpatient and outpatient treatment programs, including detox. Another large group of them would go to special support, social support type groups like 12-step, AA, NA, Smart Recovery, etc. And then another group of them would go to non-AA type community support, whether this is faith-based in a church, sober living facilities, recovery community centers, and a variety of high school, collegiate, and state and local recovery centers. And then another group of them primarily got better, or they credit mainly medication assisted recovery, whether they're on Suboxone or Vivitrol or other medications like this. But about 46% of them said basically, you know what, I just got better. I had a problem and I stopped without employing any of those kind of classic medical and social type methods to do it. And so as we look at the numbers, what were the percentages? So if we start, and again, I'm going to go over this just so you can follow along. About 20 million said that they had a problem and they're better. About a little over half of them said I use sort of the standard type of treatments. And so just for the sake of argument, let's say that number is around 10 million. Then of that 10 million, about 27%, or a little over a quarter, credits mainly the professional inpatient and outpatient programs. About half, about 50%, said it was mainly the groups like 12-step, AA, NA, Cocaine Anonymous, or secular sort of equivalent smart recovery. And then about 10% said it was the medication, and about 20% said it was the non-AA type community support. Again, that would be going to faith-based programs, sober living facilities, recovery community centers, and the like. So that's how it broke down. The most people in this study credited AA or social type support, followed by professional treatment, inpatient and outpatient, like intensive outpatient programs, and rehab and detox. Then after that, non-AA type community support, and finally the last, and they separated it out, but it seems to me it should be in the professional group, that medication assisted treatment. And so that's how the a little over half that got well say they did it. But it still leaves, an incredible question. About half the people didn't do all those classical kind of things that we think we need for recovery. And, and it begs the question, how did they do it? Now, some people say, well, maybe their illness was just very, very mild, or that, and there's some legitimacy to that argument, although probably not very mild, but probably less significant mental health issues. And those people primarily recovered from abusive cannabis use, whereas the people that required the more intense services were dealing with alcohol addiction and opioid addiction, which is a little more intense. And also they had more likely to be involved with the drug court, the criminal system, and also have more significant mental health issues. But that's still a very large group of people that got better without the traditional treatments. And we do know that some people, just like with cancer, can have what's called a remission, where somehow the cancer just turns off and it goes away without any treatment. And so some people speculate that that may also be a mechanism, but I think it's a mistake just to blow this off. We need to research that and find out what were they doing, because maybe they have stumbled onto the golden ticket, the magic pill, the process that works better than even anything that's been discovered so far. So that's it. It's also called the National Research Study. Based on that, we've learned several things, including the fact that lots of people get better from drug and alcohol problems, that there are many pathways to recover, all kinds of different things, including pathways we don't even understand. And so if you're struggling, there's help out there. I encourage you to look for it. We'll see you next time. Please subscribe to my channel, and I'll talk to you later. Bye now.